Welcome back to our suturing video series. This technique is illustrated by Vedant Lal and moderated by George Stragotos. You may now pause the video and observe the diagram closely. First, ensure the wound edges are well approximated. Begin with a standard simple interrupted stitch at one end of the wound. Insert your needle at a 90-degree angle, roughly 5 mm from the wound edge, as demonstrated here by Vedant. Then exit in a similar fashion on the opposite side. Secure a knot just as you would with an interrupted suture. However, as you observe here, you don't cut your suture. Instead, you proceed with your needle to continue suturing along the wound margin in a linear fashion. After your initial knot that Vedant will now finish, you pass the needle again through the tissue, entering at the same depth and angle, and exit on the opposite side about 5 mm ahead, maintaining equal bite sizes. Pull the suture gently to approximate but not strangulate the wound edges. If you do strangulate them, if you pull too tightly, then you will end up with a tissue that doesn't heal properly and creates a scar. Observe Vedant, as we said, entering at about 5 mm from the wound at a 90-degree angle. And the final outcome you want to achieve is something like the demonstration, in the illustration on your screen. Here, the video has been fast-forwarded to allow Vedant to continue down the wound. Always remember to be at 5 mm away from the wound, with equal bites to have a uniform suture that will allow proper tissue healing. As you continue moving along the incision, each time place equal parallel bites of equal width and depth. Keep an eye out on the tension. Too tight can lead, as we said, to puckering, too loose, and you risk poor approximation. Once you reach the end of the wound, as Vedant has done here, place your final stitch in the usual manner. Then tie off with a secure knot. This can be done either by reversing direction, looping back slightly, or by anchoring to the adjacent tissue, depending on your preference and local hospital protocols. Here Vedant is using a loop, the loop technique, as you can see. Inspect for even wound edge approximation and ensure there is no excessive tension or gapping. That's simple, continuous technique, quick, efficient, and straightforward. Thanks for watching, and remember to check local guidelines for choice of suture material and removal times, which may vary depending on the site and the patient's overall condition. Thank you for watching, your Surgeon.